and welcome to the Paw-sitive podcast. I'm Dr. Sam, and with me, as always, Dr. Robert. How are you doing?
Hey Sam, how are you doing today?
I'm good. You look very relaxed today.
School I was
Your
busy
hat
working all
on.
day. I was like, you know what? I'm gonna be a little more casual for this
Hey,
podcast. So
I like it. I got like a sweatshirt on. I'm pretty cozy tonight too, so that's good. I've been driving all over the place this weekend, so I'm like,
yeah, you just got back from
let's just chill
Chicago.
out.
Yeah, you had a
um,
busy week.
yeah, it's been crazy, but you know what? I'm here. I'm excited. I'm ready to talk about, well, stress and anxiety in our pets.
And in our lives. This will be a
And in
human
our lives.
podcast as well.
Yes. We could talk for a really long time about that for sure.
Yeah, no kidding. So I
Um,
guess the best place to start would be how it impacts us maybe as veterinarians and the pets come into the hospital.
yeah. And like kind of what we see in the clinic. I mean, I think this is such a huge topic that this probably will not be the last time we talk about it. We're really just kind of making like almost like a general introduction.
Mhm.
And so, this is a really good one. Like if anything we say sparks questions, remember you can always send us like specific questions that maybe we can elaborate more on a specific condition, a specific concern, at podcast@mybalto.com, so that we can really start delving into some things that people are really, really interested in, which I think would be helpful.
Yeah, no, I agree. And then hopefully we will try and get a couple behaviorists and trainers on in the near future as well. So we can kind of go over some different things that might be helpful in a more specific nature. But we'll kind of touch on the basics today.
Yeah. I think too, like there's a lot of stuff out there on the internet or just like on the TV, especially now there are so many shows that are like, it's Me or the Dog or like Caesar Milan or whatever. And people, you know, without the background, the training, the really understanding of like why they're approaching things the way that they are, and like maybe understanding a little bit about dogs and cats. First off, they're not the same. They're very
Yeah,
different. The things that
oh,
drive them,
definitely.
the things that like, make them tick kind of are totally different. And we see their stress and anxiety manifest in different ways. Um and there's definitely ways that you can like be proactive, before you bring them to the clinic, before you move your house, before you bring them home, like literally runs the gamut of like really trying to pay attention to, what their needs are, what their fears are, and understanding like how important your role is in, helping them along with that. Um,
Yeah, I couldn't agree more because I think, and they get a lot of that energy off of owners in general. So if you're more
yeah.
prepared, I think we all know like a lot of times we'll have pets that realize that we're not feeling well. They're very much paying attention to that. And a lot of times they'll be nice for that day. They'll be less annoying. They'll want to cuddle up on those days.
Mhm.
They're very in tune with our emotions. So that way, if you know they're going to be stressed and you're stressed out about it, it kind of just potentiates that cycle,
Oh yeah.
unfortunately. So
Yeah.
it's very important to plan ahead when you can. You can't always, but there's so many different schools of thought, and I'm actually excited for this podcast in general and future ones about this because I think it's a really cool topic and something that comes up. And that's us. I think if I remember correctly, behavior is one of the top reasons for animals being euthanized.
Or surrendered. So
Or
so
surrendered.
a
Thank
lot of
you.
times the reason was why people don't keep their cat or their dog is something that has a behavioral, thing at its core. It may
Mm,
manifest into a medical condition, and that can happen sometimes,
yeah,
or into like aggression or into like a behavior that they just can't then handle. But
yeah,
the initial core of it is, a behavior component, and a lot of times it's something that if you were recognizing it early and dealing with it early, you actually you can fix, you can change or improve. There are some things that I will say that you do have to decide what you'll accept, like as an owner,
mm,
as a person that's a guardian of this animal. Understanding like also the length of time you're going to have to deal with it, and then
yeah,
knowing, what you're able to deal with and what you really can't deal with. And I think a lot of times, um behavior, what I find a lot of times, not always, I mean, I definitely will have those people who like will make an appointment to discuss this behavior they're concerned with
mhm,
or something like that. But I can't tell you how many times we'll have spent, the whole time, doing our physical exam,
yeah,
talking about these like physical concerns that we have. And then literally I'm walking out the door and as an afterthought, it'll be, oh, hey, and by the way. And
yeah,
unfortunately, like I am one of those people like I want to help. I really do. If your pet has like behavior concerns or anything like that, like I really think that that's so important, but it is not something I can address in the 5 seconds before I walk out the door. Like that
Oh yeah.
now just starts a whole nother thing. And it's hard because I also really do understand, like, people are busy, they have about 18 different things going on, and they've made the time
Yeah.
to come, and this is the time where they wanna try to, like, talk about everything that they can. But I do think that sometimes the behavior conversation is its own appointment, and I think
Oh
that's
yeah.
okay. Like, I think you realize that, like, your veterinarian's not gonna get mad if you wanna call and, like, have a consult with them, in person where you can, like, sit down and really, like, talk through their environment, talk through, the things that you've noticed to be triggers. If you're not sure what their trigger is, maybe just have a conversation about, like, what you're seeing, and then sometimes we can really, like, go through it and say, yeah, that I think this is the trigger or that is. And sometimes truthfully, we don't know. Like sometimes I'm like,
Yeah.
I can't tell from your story what was the trigger there, but maybe if you work with a trainer who can come to your home and actually see what's happening, they may be able to tell you, oh, hey, you know what, this thing that happens 5 minutes before this behavior starts is the trigger, but you're not
Yeah.
recognizing it because they don't seem to be attached or something like that. So sometimes there really isn't a place for like them to come to, to have someone come to the house or videotape. Videotape is my favorite thing. If people can bring
Oh, it's
me
the best thing.
videos of their because then I'm like, oh, well, that's, like two dogs playing. I'm like, oh, that's fine. That's happy play. That's not a problem. Or, oh, no, no, that's aggressive play. Like, that's not normal. This is gonna become a problem, this is gonna escalate, somebody's gonna get hurt, that kind of thing.
Yeah, no, I was actually surprised at the detail because I had a behaviorist appointment for Loki way back when I first got him because he had some anxiety issues. I wasn't sure as a young, really, I was a student at that time, how to handle it.
Mhm.
And they go into a lot of detail about your history, very much like you're talking about. Like they ask you what you're doing beforehand. They go into like that's half the conversation. It is not a 5 minute conversation. It's
No.
definitely not a 5 second conversation. It's definitely something worth making like an individual appointment with your veterinarian about if you have concerns because there's a lot of behavior issues, and obviously we're gonna try and focus a little on um, anxiety a little bit with how it affects us right now. But there's a lot, like I said, there's aggression, there's like so many things that can affect our pets. So it's a big world for
Oh, yeah, I
that
mean,
sort
it's
of
an
issues.
entire specialty, right? So, like,
Yeah,
it is almost like it's almost laughable to think like, "Oh, yes, we're gonna have this quick conversation and we're gonna cover anxiety." It's like, no, no, it's a whole specialty in veterinary
yeah,
medicine, and like you were saying, so did you go through the behavior department at MSU with
yeah,
Loki? Is that what you did?
yeah. Who it was with?
Dr. Hop.
Yes, thank you. It was with Dr. Hop. Thank you. Your
Yeah.
memory is way better than mine.
She was great. Do you
Good
know
job.
if did Ashley help you? Like, because I know that
Actually, I worked with Ashley a little bit afterwards because I know it was
we
a
should
couple
call
of
her Dr.
years.
Hopkins now, right?
Dr. Hopkins, yes.
Yeah.
I was
But
like,
but yeah, she was a classmate of ours that was really interested in behavior. So I was just curious if like she helped you at all.
yeah, no, I've even touched base with her a couple times afterwards, like, hey, Loki's been doing this, and she's still very knowledgeable on it. And I think it just shows that we can't know everything. And it's nice to have colleagues that do have a better idea of it because their behavior is very complicated for so many reasons.
Hmm. And we
So,
all have things that I think we gravitate to normally. So like there's things that like I just genuinely enjoy. And so those are
mhm.
the things that you spend a lot of time reading about, looking into and stuff like that. And I feel like with her it was like, oh, this is so interesting to me.
Oh,
So
yeah.
now I have all this knowledge and whatever. And it is nice that we all kind of have those little things that's like, oh, this was my thing. Like I love this. You know what I mean?
Oh, yeah.
Like give
No,
me
I
the
agree.
disgusting
That's how I feel
wounds that
about
you can
ER.
give me. Huh?
That's how I feel about ER. It's like,
Yeah. That's how I feel
like
about
ER.
wounds.
Yeah, exactly. Wounds.
Yeah.
Yeah, you and your wounds, you can stay over there.
Give me the most disgusting, horrifying wound ever, and it's so fun to fix them. Not that they got wounded, but to watch them heal. I love.
They're pretty incredible how well they can heal.
Yes, they're like magic. It's amazing sometimes.
Mhm. It's pretty
Um,
awesome.
but yeah, so we all have our things.
Exactly.
But I guess, yeah, so I'm curious to know, so like what that process was like with going through like an actual specialty for it, because I think that that's helpful to know that even exists.
Yeah, I think so. The biggest thing is they definitely take a lot of history. Like history is a big part of it. So that's why it's not a short conversation because they had me write down like his feeding schedules. Like they gave me like I feel like it was homework. It was like a 6 page
Yeah.
document of like all the things that I do when I do them, how he interacts with other dogs, cats, people. It's a whole spiel and when those occurrences happen. So that's the biggest part in the beginning, getting a lot of history. And then when you get there, they kind of talk you through it, what things that, and even things that I'm still learning now. Even I didn't realize some dogs, even just licking you, is actually not a good thing. It means like go away. Like it's a nice way of saying like go away in some dogs and how they're doing it, which is kind of funny. Some dogs use it as it's a sign of anxiety in other dogs. So it's
Mm-hmm.
just how they're licking and how that's presented. There's just so many different variations to dog behavior and cat behavior for that matter. So it was nice to kind of get a chance to talk to them about each thing. And then I think the most important thing at the end of the day is some people are really against medications. Um, and how it was described to me, and I kind of follow the same belief now, is that nobody wants to have their pet on medications lifelong. But it can be used as a tool to kind of help them listen to you because when they're anxious, they can't hear you. They're
Mm-hmm.
so wound up in their stress that you're trying to talk to them and they don't understand what you're saying.
Yeah.
Medications give you that time for them to understand you. And then that way you can, once they understand you, they know the term, then you slowly start taking those medications away and
Mm-hmm.
they can understand you without having them on board. And I think that was a really insightful way of putting it. And it wasn't from me originally. I'm not going to claim that, but it was a nice way of thinking about things because I didn't want Loki on medications lifelong, but after I trained him enough to get past his stress, now we're great. He hasn't been on them since. So it just goes a long way. I think behaviorists are wonderful people. We need more of them, if
Oh yeah,
anything.
for sure.
Such a big issue. So
Especially since
kudos to those.
COVID, there's been so many dogs that really struggle.
Oh, COVID. Yeah. I can't even imagine.
Mm-hmm.
Yeah. It's just, there's so
Well, I
many
have a COVID
COVID.
puppy, so I can tell you right now that it definitely
It's,
changed
it's
the
a,
way that you deal with things.
it's a really cool thing. I think it's
Mhm.
fascinating how many dogs, like people just went back to work and their dogs are like, oh, my situation's changed and they
Yeah,
stress out. And I mean, you can
yeah.
speak to more of it than I can. I got to take my dog to work, so it worked out. So
Yeah, that I can take my dog to work, but
that's true.
not I don't every day.
I do every day. He goes every day with me.
He literally like becomes such a wacko when he goes there. Like he loves it there so much that like he is at literally an 11. Like the second he sees that building, he's like, "Yes, everyone loves me here." And
He
he
love
like
me.
he literally I have seen him jump like you know how Jack Russell's like the way they
Mhm.
jump. Well, he's a lab, like he's a 50-pound lab, and he like we have a treatment table that has like a bunch of stuff kind of like already organized, everything's like laid out the way it's supposed to. We have like needles and all sorts of like very neatly laid out, organized, everything. He jumped all 4 feet from the ground up on to this, knocked everything off. I was like, I'm so sorry, guys. Like, I did not think that he would be quite so naughty, but yeah,
I
he.
did not laugh at that though. I think that's hilarious.
Oh no,
Like,
everyone thought it was hysterical, but it was just like,
yeah,
where did he get these springs? Like, he's Tigger, you know what I mean? Like, he was just like,
it's so
but
excited to be here.
he is. I know he's like, I can't. I'm just like, ah. But that speaking of that, like that was one of the things that our trainer when we first got Gus, because again, I don't think I know everything. And I was sure that there was stuff I could learn from a really good trainer. And I got really lucky because we've got a great one here who
Oh,
is a
nice.
registered veterinary technician. So she understands when medicine is needed. She really understands like how that is such a good adjunct to some like behavioral stuff and all
Mhm.
that. But she really like was like, yeah, you're never gonna get him to do what you want when he's here. You got to get him down here, then
Yep.
you can have a discussion with him and he can understand what's. But like if when his brain is gone, when he's at a 10, there's no point. So you have to try to anticipate and keep him at a 6 where he can hear you, he can react, he can listen, and he has those things so ingrained in him that
Yeah.
yeah. And
I
and
100%
going
agree.
back to the medicine thing, like I do understand not wanting constant medication, right? But
Huh.
the brain is part of the body. And there's times where, people need to be on medicine, dogs need to be on medicine, and some dogs really do benefit from being
Oh.
on Prozac or Zoloft or
Mhm.
one of those medications lifelong.
Yeah.
It improves their quality of life, and they are very safe, they're really well tolerated.
Mhm.
So, while I totally agree with you, like, I do think that sometimes we're like, "Well, I don't wanna drug my dog." It's like, I totally agree, and if we can work together and change some of those behaviors, figure out their management, change their environment, like, do all those things to make it so they don't need it, awesome, we'll wean them off of it, no problem. But if they
Oh
need to
yeah.
stay on it forever, Also no problem. That's okay.
Yeah.
You know?
Because I think it lowers both your stress and the dog's stress, like,
Oh
and
yeah.
cat, depending on who it is. But it lowers both your stresses, and it's such a good thing long term. And I think that's that negative association people have with it, just like drugs are bad. It's like, oh, they can be pretty helpful sometimes.
Yeah. Or they think they're gonna take away their personality or something like that. And that's not really true. I think sometimes the anxiety takes away their personality. Sometimes the fear takes away their personality.
Yeah,
And when you can just take some of that away for them, it's like, oh, okay, I get to just be a dog now, or I get to just be a cat. And there are, I mean, cats, so Prozac can be the thing that
great.
keeps a cat in their house.
Hmm.
So, I'm never going to say like, oh, I'm not going to do drugs. I think sometimes you need drugs, really do.
Sorry, that's like you like you need drugs.
Sometimes, yes, better living through chemistry. But actually, and I will say, especially when we're talking like as needed medication. So like
Oh,
there are some dogs that come into the veterinary clinic and are it is like they are so nervous. And not because
yeah.
anyone's mean to them. Nobody has to ever have done anything mean to them except to just hold them still, or you know what I mean, like just
Mhm.
restraining them to keep them still while we draw blood or while we do something can be massively scary to these
Yeah,
guys. And if sometimes it's just like, or sometimes they're just like, they'll let you do everything. They're not mean, but it's just like, oh my gosh, you know what I mean? It's like if I just gave them some medication ahead of time, a couple of hours before, they're like, oh, cool, I'm gonna take a treat from you. This isn't such a bad place. I actually kind of like you. You know what I
yeah.
mean? And the goal isn't to drug them every time, but some dogs you have to.
No, I think it's a good way to transition to into like how are some ways that you talk to owners along with medications to kind of calm pets' anxiety as they walk into a or any practice really, but just into your clinic. Like, what are some methods that you talk to them about ahead of time?
Yeah. Well, first off, like I think it's really important. Like some clinics, I think at this point now, like everybody is trying to be as fear free as possible. Like
Yeah,
that means like trying to, get them to not like starting from a puppy, like we're feeding them cheese, like we're giving them treats, and like especially while we're giving shots or doing anything that like looking in their ears, like most of the time, most of these puppies are just like, this is great. I'm eating cheese. I've got cheese everywhere. I'm so happy, and like they don't even notice that they're getting shots. We like you've
mhm.
seen those like videos of the guy that's like dancing and then like pops a little kid, or I swear that's me. I'm like squeeze, squeeze, squeeze vaccine, like cheese, yay, like try to make it so that they have no idea what's going on. And most puppies, I would say that works for them. And they don't
Yeah,
care their entire puppy series. They're so happy. It's so great, whatever. But then they don't come back. Like they'll get neutered or spayed or whatever. And they don't come back for a year. Well, now they're in a
yeah,
completely different dog by the next time they come back. And people are like, I don't know. They were never like this when they were a puppy. I don't know what happened. Did something happen? And it's like, they haven't been here in a year.
yeah.
So this
I would
is a
agree.
complete, they're being asked to, I'm going to open their mouth. I'm going to look in their mouth. I'm sticking something in their ear. Who does that at home? Nobody. And then I'm going to like put all their joints through range of motion. We're going to hold them still. I'm going to listen to them. I'm expecting them to do all this stuff that like nobody's done to them in a year. So yeah,
Hmm.
when they were a puppy, they didn't care. They were eating cheese. They're, yay, this is great. But like by the time they get to be an adolescent, they're like, whoa, whoa, what's
And I
happening?
think all the more important too is those cats that don't see a clinic for like 9 years. Sometimes, like,
Oh my
oh, they've been
gosh.
healthy for the last 9 years. Those cats are terrified when they walk
Yes.
in, like
Oh yeah. I
absolutely
mean,
terrified.
yeah. It's actually surprises me how many animals are totally cool with what we do, because we really do ask them to like just stay still while we do whatever we want to you. You know what I mean?
Yeah,
So yeah, we try to really like, you know, food and giving them love and like trying to make it so that like they don't realize that what we're doing is an exam. You know what I mean? But some
yeah.
things are unavoidable. I mean, sticking a needle in a vein, there it's unavoidable that that's like not cool. You know what I mean?
That's not cool. No, but I
So,
agree, and it's
yeah.
actually nice to hear that side of things because honestly, I love the hospital we work at, but we don't really do a lot of on the ER side of things.
Yeah.
The fear-free practices because they're not as I'm not gonna say they're not applicable, and I think I need to learn more about it myself. But I think the timing wise, like when your pet has a bleeding abdomen, like we have to hurry, and then or they're vomiting, they can't like we can't give them cheese or other things like that. Things that are
Oh,
gonna make
yeah,
them
yeah,
vomit
yeah, yeah.
more. So it's kind of nice to hear this side of things because I think even I forget how much work goes into the fear-free practice. a lot of veterinarians do while your pet comes in, because they really do care and they want to make it as a good experience for you and your pet as possible.
Mhm. And I think that that's why, like, I also hope people understand that, like, when we recommend, like, hey, maybe give your cat some gabapentin before they come, or give your dog
Mhm.
some trazodone before they come. It's not because I am like half the time that cat is terrified, but they let
Mhm.
me do everything. But they're
Okay.
terrified. I don't want that. I want them to enjoy coming, or just not hate coming. You know what I mean?
Yes.
Not then like act like a different cat for a week because they just were at the vet. You know what I mean? Like
Mm.
I have definitely had, like, it was really interesting. I had this one pair of cats that they would go to the clinic and they would come the same day, right, for their vaccine appointment.
Mhm.
But then they'd go home and they'd fight after
Oh, really?
for like 2 days after. But then we started giving them gabapentin before they came, no problem anymore. Like,
Oh, cool.
something about maybe the smell, like each other smelt the vet clinic on each other or
Mm.
whatever. And you hear stories about that, like, you have a house with like 4 cats, and one goes to the vet and comes back, and all the other ones are like, "Oh, you smell
Well,
like the bad place." You know what I mean? Like, so it's like there's things you can do to say, like, "Hey, we know that this is going to be stressful.
mhm.
So how do we mitigate that stress ahead of time?" And so with cats, gabapentin, which is a human pain medicine,
Yeah.
works wonders in cats. I'd say, like, I've had cats we couldn't even touch, and
Oh,
then
yeah.
give them some gabapentin, and the next time we can get all of our samples. We can, sometimes we have to go quick. Like cats are usually like, hey, try to be quick, see what you can.
It's
Yep.
like a little timer will they go
Yeah,
off.
exactly. Your timer goes off. Yeah, exactly. And some cats I will say shut down. I mean, some cats just lay there like,
Yeah.
I'm a potato. You can't, like, I don't, don't don't touch me. But other
Yeah.
cats are, I mean, they will strike, they will hiss, they will do everything they can to get you to stop doing what they're doing. So gabapentin is like awesome for that. And
Oh,
truthfully,
sounds perfect.
trazodone actually works great in cats too. It just doesn't, it tastes bad, and I
Yeah.
think it's harder to give.
Mhm.
Um and like we actually have gabapentin compounded for cats. So like they can have it in a marshmallow chicken flavor so that it's lovely for them.
It's better than the
Lovely-ish.
cherry
I've
flavor that
tasted
we
it.
have.
Huh?
Better than the cherry flavor I think that we have. So, yeah. Marshmallow sounds lovely, actually.
Yeah, I think the human one is cherry flavored too, right?
Oh, maybe that's probably well, and that's a quick caveat, although gabapentin is used in cats, not human gabapentin because it has xylitol in it, so be careful. Don't just
Yeah, I was
give
gonna
them
say for
your
dogs, yeah,
yes,
you
for
gotta
yeah,
be
for
really
dogs,
careful.
don't give them your gabapentin because you
Yeah.
heard from us that's okay to give. It's, talk to your vet
Well,
first.
the pills and the capsules don't have xylitol in them. The oral suspension does.
It's the oral suspension, yeah, I think it's one of the yeah, I can't remember which one it was,
Yeah,
but
yeah.
just I know I've had a couple owners come in, they've given their dogs their own gabapentin,
Yes.
and we were like, "Well, now we gotta check if it's got xylitol in it," and
Yeah,
it's a thing.
yeah.
So just
So be
don't do that.
careful. Yeah.
Yes, be careful. But it's a great medication, and I think
Yeah.
it's just yeah, making it easier to go to the clinic. And I think kind of along those lines, like the more times you can bring them into the clinic consistently is really going to help them make it like not a bad experience all the times.
Mhm.
Like when they get to go see your primary vet, first couple of years or first couple of months are great because they're getting all this food and it's a pleasant experience. Even if you take trips to the vet and don't take them in, sometimes that helps a few pets out just in getting in the car.
Well, especially
Um,
dogs, I think dogs is easier, like a happy visit, where my clinic is, we're right in the middle of like, Targets across the street. Like there's stuff around. So it's like maybe the next time you go by and you're picking up your like curbside order, shop them by, bring them in, we'll give them a treat. You can weigh them, take them out again. They never have to see the inside of a room. They can just like
yeah,
get a happy visit. I would say that people don't realize, like, we welcome that, but so few people take us up on it. And it is really nice. Like the girls in the front, they'll be like, "Hey, we love you. Yay, here you go. Let me give you some treats." And then you go off on your way. It's a 2-second
yeah,
thing, but at least then they have like that was a good place. You know what I mean? Or get
exactly.
whatever pup cup you're going to give them anyway. Just give it to them in the clinic.
Yeah, it just helps reduce that stress, but I think it's great, and I think like I said, between medications and frequent visits,
Hmm.
happy visits,
Yeah, and some dogs, like, have, like, a toy they really love. So, like, one of the girls I work with, her dog always has his, like, little doll with him for the day.
uh,
So he comes and he holds it, and he just holds it in his mouth, and so he's perfectly happy because he's holding his little doll in his mouth, and
which
that
is the
makes him
cutest
really
thing ever,
happy.
by the way. That's all I want in a dog to like just hold a toy, and when they walk in, they don't let it go. This,
He is, I will have to send you a picture because he is the, like, cutest old man black lab, like, ever,
oh,
and he is so sweet, and he always holds his little doll, and he's like, And he has like he picks his doll for the day. Like she has like
Oh,
a thing of them, and then she's like, "Okay, Gar, get your doll," and he like goes and he gets his doll and he brings it. And I will have to send you a picture because he holds it all like anytime you go to do anything to him. I had to take a cytology on a lump one time, and he just held his little doll. It's like so he's such a good boy, you know. And
that's
so
all.
it's
That's
it's
cute though.
good, yeah.
Mhm.
And I think so I think also too, one of the biggest mistakes we'll make if your vet tells you that your animal needs medication, really do the timing that they tell you, like giving it 2 hours before is so important
Mhm.
because a lot of times people are like, oh yeah, I just gave it to him. And I'm like, okay, so 2 hours from now he'll be really, really calm.
Yeah, it doesn't work that quick.
Yeah, yeah. And sometimes it actually takes a few tries to know like what the right medication is going to be. Sometimes some dogs will override the medication. So
Mhm.
doing a practice dose at home to be like, wow, that really knocked them out, or literally they were like laughing at me like, did you give me anything? Like that was nothing. It's good feedback to give your vet cuz they can then add something else, like sometimes you'll do two medicines together or three medicines, and there's a whole protocols that
Oh
that
yeah,
help dogs to kind of relax and calm down before they come. Same with cats too.
yeah. No, I agree. It's like there's plenty of options. So having that conversation with your primary vet, it's super helpful ahead of time because even I can't tell you how thankful I am for the veterinarians that talk to them, their owners beforehand, and then they come into the ER later on. And like, oh, we give our cat pet ahead of time because they don't like being here. I'm like, that's great because
Yes.
now both our visits can be better.
And I guess
So
that is a good note. Like if even so, like people know to do it before they come to see me in primary care for their vaccines and all those things, those expected visits. But I would say if you're gonna bring your pet to the ER, probably call ahead and, if they're not vomiting, make sure that it's a safe thing. I mean, I would say like respiratory distress, so having trouble breathing or
yes,
um, vomiting, you're probably not going to be able to pre-med your dog, but or cat. But like an orthopedic injury, which I think we're going to talk about soon, or we'll have a
yep,
podcast like just about some of these orthopedic conditions that we see pretty routinely in our pets. But that's a good one. I mean, because they're going to come in, they're going to be stressed, they're painful, um and so many of them are so safe that you can give
oh
with
yeah,
other medications and things like that. And we routinely give pain meds and anti-anxiety meds at the same time, and we know which ones are safe and which ones are not. And almost universally, I mean, trazodone is going to be like a nothing. Like you can definitely give that before,
yeah. Trazzone's really
right?
safe. Gabapentin's really safe. Tramadol is probably the one to be careful with when you're mixing with other drugs sometimes. But yeah, most of them are pretty
But it
safe to
calms
do.
them a lot of times, and more so than it does anything for pain.
Oh yeah, I don't think it works. I mean, that's one veterinarian's opinion, but I don't think it works for pain very well.
It's not
But
just
it's a
one.
great, yeah, maybe not just one. But it does help with calming them down, and
It
that's
does. It
helpful.
does. Yeah.
So it just depends on what your goal is. So
Yeah.
I don't know, but yeah, I think those are the big things to keep an eye on when you bring your pet in. Like I said, reducing anxiety as much as possible, and you not being anxious as well. I can't tell me owners are like, "Do you have something for me as well?" I'm like, I can't give you drugs,
Yeah, yeah.
but
No, we can't do that. That's illegal. And I will say that I think that there are times where some dogs do so much better away from their owners. Like
yeah,
as soon as you take them out of the room, they are so much calmer. Not because their owners do anything wrong, but just like again, that anxiety that you're talking about, like they're just it's permeating their room, and dogs are very
yeah,
and cats are very in tune with their owners. And then some dogs though, I have also seen the opposite. Like we take
yeah,
them away and it's like, whoa, nope, we're going right back in. And as soon
yeah,
as we and so I will sometimes say to people like, "Are you comfortable watching me draw blood? Are you comfortable with me doing, a pressure in the eye? Are you comfortable?" Like all those types of things that like I'm perfectly comfortable doing most anything in front of an owner because I have not there's nothing that I don't feel like, anal glands I think that they wouldn't enjoy, but I would do it in
nope.
front of them. It just smells
it's
so bad. You know,
it's really
so
awful.
there are certain things we do, like we take them into the treatment area, which is take them into the back, the scary back that we take them into. More so just because like we have some more stuff back there. Sometimes like I have a way brighter light back there, so sometimes I can like see things a little bit better. But then it's also like things that smell. I try not to do
Yes.
those in the room because then they'll stay in that that smell will stay in there for like the
Oh
rest
yeah.
of the day. So
Yeah.
so yeah.
Exactly. In some cases too, it's also because of restraint. I Some things are not so bad for owners to hold their pets for, but some
Yeah.
things are a little more uncomfortable. Like if you're feeling for a fracture or something like that, it's uncomfortable. And animals, in a nice way, are going to say no by trying to bite sometimes. And it's just nice to have trained technicians or other doctors helping you out, and that's a lot of times the only reason we'll bring them to the vet, just because we'll make sure we're safely handling them and reducing their stress as much as possible. But
Hmm.
I think I agree. I think well, you've heard of Veg,
Yeah.
Veterinary Emergency Group. One of their big philosophies for those that don't know them is that they actually allow you to stay with your pet at all times. Like even like you can watch the surgery, you can be in the exam room with them the whole time. They're doing procedures like a chest tap or anything like that. You're with your pet the whole time. And initially, I was cautious about it because it's a lot, and sometimes having to explain things to owners like during the moment, and they may not understand why certain things are happening, and it makes you a better teacher as you go. But I really like their philosophy. I think it's interesting. I'm not sure if I'm quite comfortable with it yet myself, but if you have a pet that maybe does better with you at all times, you've been to the vet a couple times and they get worse when they're away from you. Not that you should change your veterinary hospital or your emergency hospital, like go to the nearest one, but if there's an option, veg isn't actually a bad choice if your pet does better with you than without.
I think you also have to know your personality too. Like I could say like my brother-in-law, like he doesn't like blood. He doesn't
Oh, yeah,
like any of that stuff. So like he would not want to watch any of that.
good. Yeah.
And so I feel like that is something that you should also know, like if you're going to get panicky in a
Mhm.
situation that could make a situation that is under control suddenly be out of control, you should know
Yeah.
that about yourself. I think that not everybody thrives in those situations and there's nothing wrong with that.
Mhm.
Um but yeah, I mean, I think that it's a really cool business model. I feel like for the people that it works for, like the people who
Yeah.
get energized by like people around them all the time and like, like kind of thrive on the energy of like having everyone there. I think I feel like it's a really cool thing. It's not that much different than probably what most large animal veterinarians would
Mm.
would kind of like have on a regular basis, right? Like you go to someone's farm and you
Yeah.
do whatever you do for their animals, usually with the owner's help. I mean, so I think it's always been in veterinary medicine. I think that small animal clinics have always operated a little more like human
Yeah.
clinics, and this is kind of finding a way to meld the two a little bit where you're like, "Hey, sure, I mean, come and be a part of it."
Mhm.
And I think I've even heard from some people like people ask like, do people get disruptive? Like, what happens if things go wrong? And like, apparently, people are actually way more understanding because they've seen the care throughout. They understand that their pet was
Yeah.
never alone. Their pet, what you know what I mean? Like, because bad outcomes happen, no matter what kind of a doctor you are, no matter how good you are. That we are not God. We can't like control everything.
Oh, yeah.
And so I do think like it's a really, really interesting thing. I think it works better in like an emergency situation,
Mhm.
you know what I mean? Just because those are so heightened and it's like,
Yeah.
now I understand why I had to wait because I saw all these other things. I see you doing CPR on that dog over there and my dog is still breathing. So okay, I'm still okay to wait a little while. So you know
Yeah.
what I mean? Like I do think there's definitely settings where it works better.
Mhm.
I don't think it's for everybody though. I really don't.
I 100% agree. I think it's great for maybe relieving some anxiety for owners who are just wondering like what's going on back there. Or and again, if they can help ease their anxiety because their pet will notice that as well.
Yeah.
That's great.
Yeah.
But yeah, I think you put it really well. Is know yourself
Mhm.
and your pet as much as possible because it may be the right place for you, it may not be.
Yeah.
But it's an interesting business model.
Yeah, and same thing with, like, thinking about just, like, how to prepare your pet for coming to the vet. So, like, a few things because I think we're gonna wrap up a little bit more, but we'll definitely re kinda touch on this, maybe more specifically cat, more specifically dog, because it's kind of a
Yeah.
general thing. Um, for cats, I would say, um, don't let their crate only come out just before you take them to the vet. Their
Mhm.
crate should be part of their world. It should be something that you feed them in sometimes. You have it always open. They can come in and
Mhm.
out of it freely because one of the biggest fears that people have, that cats have, if they don't know their crate, is like, why am I in this box? Like, what is happening to me? And then I go to the place where I get poked all the time and this is horrible and it smells weird. And, you
Yeah.
know, um, some people will even put some feel away spray in there, which is like a pheromone. It's a natural way to kind of calm your cat down. That can
Mhm.
be really nice. obviously gabapentin if you need it ahead of time for your cat. And sometimes even if they behave really well, but they are just super fearful, talk to your vet about it. Most vets will say something like, I will, even if a cat was perfect, but I'm like, they seem terrified. Let's give them some gabapentin. And I've
Yeah.
definitely had it help. Um, so I think with cats, like that's the biggest thing. Like, don't let their crate. Oh, and don't please ever take your cat to the vet without a crate.
Oh yeah, actually
That
that's a
is,
really important.
please don't do that for so
Yeah.
many reasons. Your cat may be awesome, and you may have the one cat that is fine on a harness, but I have had people not even have them in a harness, just have them in their hands.
Oh,
You are walking into a place
with
where
dogs.
they may be fine, but there's huge dogs. There could be
Yeah.
a dog that will attack you and your cat. That is a perfectly nice
Mm.
dog, but maybe has a really high prey drive. I don't know. But
Yeah.
either way, it is, or like my clinic is on a main road, right? So yeah,
Yeah.
we're in our own little building and everything, but like if that cat gets out of your hands,
They're
they're
gone.
going on a main street. So
Yeah.
please, a crate, always a crate,
Yeah,
please.
I 100% agree. And there's some really cool crates out there, and honestly, probably worth doing its own podcast on because that does like those little cool spaceship ones, and we're gonna give you the ones that we think are best for veterinarians to help get them out of because there is a difference.
Have you ever seen the ones that you just unzip and they just lay out flat?
Well, that sounds lovely though because
They're
trying to get a
amazing.
cat out of a carrier is
Yes,
horrible.
yes,
So,
they're amazing. And some
uh,
even the ones that come off, like where your cat, like I will do entire exams with the cat in the bottom of a crate. If you have the kind that just lifts right off, I'll take it off. I will not make them get out of there. Anything I can do to keep them in their comfort zone, I'll work around them, no problem.
oh yeah, I'll work in there as much as I can.
Mhm.
But there's some definitely different varieties out there, and I still think the space bubble one is my favorite, but
Yeah.
just more to look at, not actually to use.
Mhm.
But yeah,
And
there's some
then
good options out there to bring them in a crate.
oh yeah, for sure. And a crate that they love because it's part of their environment at all times.
Yes.
That's like huge tip for cats. Then I
Yeah.
think for dogs, things that you can do. So, um if you have a dog that gets really excited being in places, maybe if they're healthy, like they're coming for a health check, like
Mm.
make sure they've been walked, make sure they've been exercised. Like try not to have them be at an 11 when they come to the vet clinic. I think it will be a better experience for them. It's a better
Yeah.
experience for the vet, but it's also for them as well.
Yeah.
Um, for those kiddos, I think too, in general, for dogs that do tend to be higher anxiety, one of the first questions I ask is how much exercise do they get? Because a tired
Mm.
dog is a happy dog.
I
And so
agree.
I think more often than not, it's because the dog just doesn't get enough exercise.
Yeah,
Like,
and it's actually one of the behavior things that I went through
yeah,
when I first got Loki. Like, it's like you gotta work with him, you gotta run him a lot. Training is part of exercise too, so they doing those things. But him and I ran 3 or 4 miles a day every day for a very long time until just to burn off energy, so he wouldn't eat stuff in my apartment later on. So
yeah, and if you're not a runner, that's fine. I mean, I
yeah,
had like we had 3 kids. I have, a dog that had a ton of energy in a time where it was questionable where we could go with him and all that kind of
yeah,
stuff because of COVID, but we brought him to doggy daycare a couple of times a week, and they were like the greatest days. He wanted to go because he got to play for an entire day. He was exhausted, and then even the next day his behavior was better. Do you know what I mean? Like there was residual, and then we could take him for a mile walk, Paul in the morning, me at night, or something like that. You know what I mean? It's like,
oh yeah,
and the thing is it made like he was a different dog when we got to do those things. And then I felt bad like on the days where I know he didn't get tired enough. He was like, kind of like a lot to handle. And it's like, that's not
yeah,
his fault. That's my fault. Like I should have taken him out. So I don't think people realize like if you can try to like schedule around that a little bit, that's really helpful.
yeah,
And if you have a dog that's so scared that they won't even take treats, you know, maybe do have that conversation with your vet. Like, is there something we can give him ahead of time that's gonna like just take the fear away from him? Because I want them to come and enjoy the situation. I want them to like be okay with getting the nail trim you want them to get. You know what I mean? Like all that kind of stuff.
yeah.
And so I think for dogs, that's a big one. Um, what do you think? Is there anything else that you think for dogs would be like a helpful thing beforehand?
I think you covered the big ones. I think a service that some people use out here is there's vets that travel to your home.
Yeah.
It's a good and a bad thing in terms of like it's great that they're in the comfort of your own home. So I think for like primary care visits, it's not a bad idea. I think just when your dog is never leaving the house and they've never seen a new place when an emergency does arise, it can be a little more stressful for them in that situation. But I think it's a really nice opportunity if your dog is just terrified. maybe it's a good way to start off in the beginning, getting them used to it and having at-home visits. They're going to be a little more expensive because someone's actually coming to your house, obviously. But if it helps for the first couple, it may not be a bad idea.
Yeah, yeah, that's true. And I think the more you socialize your dog, like remembering that, there's really like it's never too late. You may have to work them up to it. And I think that there might be some things that you need to do. There might be certain places that you can take them that are safer than others, like maybe not with kids if they don't do well with kids. Like,
Yeah.
we don't want anyone to get hurt. But like and then try those happy visits. I think for those dogs that really, are not going to be seen for a year from when they're puppies to when then they're like a year and a half. Like
Yeah.
maybe bring them a couple of times so that it's not a total shock to their system. And especially with dogs, because they're so easy to bring out,
Oh, yeah.
bring them in, say hi, and then leave. Nobody's going to get upset about that. And you can even call your vet and make sure that they're cool with it. But I would say most veterinarians are like, you want to come for a happy visit? Awesome. Great. Let's do
Yeah.
it.
Yeah. We'll give them a treat and you can walk on out. I think that's a great
Yeah,
idea.
that's it. At least this place isn't scary to them. It's like a place where happiness happens. A treat happens. Yay, we go. The
Happy
dogs that
place.
are hardest, I think, are the ones that are not motivated by food. So I think it's also
Yeah.
really important if you don't have a dog that's motivated by food, maybe figure out like what are they motivated by? If it's love,
Mhm.
if it's, whatever, if they have a toy that is comforting to them, like whatever it is, try to think about that ahead of time so that when they come for their visit, it's like, oh, okay, we thought about that. Especially if you
Yeah.
like a mouthy dog too that likes to kind of gnaw on people a little bit. Have something like have a bone, have something that they can chew on so that we can focus on our exam and maybe get them, in and out so that it's not ramping up the anxiety either. It's like, okay, sometimes we have these dogs, like we have to go slow with them. I don't mind.
Mhm.
I'll take the time. But
Sure.
some things get worse the longer they're there. Some dogs get better though if you have a vet that will just like kind of come in, sit down, feed them some food, which is what I'll do. I'll just like sit there and like I'll sit on the floor and like have a chat about their history while we're feeding
Yeah.
treats so that they start to smell me when they come over to me naturally. Then I'm like, okay, hey, now I'm going to listen to you because that's the least like scary part of it. Okay, cool. Okay, I listen to you. Now I'm going to give you a little massage, feel your lymph nodes, like I'll work into it. But some dogs, it's just
Doesn't
the
matter what you do.
longer they're there, the more nervous they get. It's not the opposite, so
Yeah.
know
No,
your dog.
I definitely agree. It's good things to keep in mind. And
And also
uh,
make your appointments for the time of day that make the most sense for your dog. So if you have a dog that is extremely nervous, there are usually times for it, like where you can say, hey, is there a time where there's a little less happening? So like first thing in the morning, surgeries are being dropped off and this one's being dropped off. And maybe that's not the best time, but like about 10 o'clock, most things have been dropped off. Half people are in surgery. So this is a time where there's not a lot of people in so that's when you come in, that kind of stuff. Like ask.
yeah, that's a
We
really good
want to
advice.
help.
Yeah. Oh, 100%. We want to make it easy for our pets as we do for you. So
Mhm.
I don't have that luxury as much, but I think that's a great idea. I didn't even think of it that way, but I think it's an awesome idea.
Yeah. So,
So
but call ahead. Remember that like we really are all on the same team, and that's the team
mhm.
to get your dog or cat healthy. And especially like if you do have a time where you have to go see an emergency vet, maybe have a chat about what you can give safely ahead of time.
Yeah.
Especially because there might be a wait too. So, before you even give like a pain medicine too, make sure that it's one that's not going to keep them from being able to do their job as well. Just a
Yeah.
little PSA there.
Nope. Much appreciated.
Well, you've been listening to the Pause It podcast. Thanks so much for listening. Thanks, Dr. Robert.
Thanks. Good seeing you, Sam.
Yeah, good seeing you too. And remember, send us your questions at podcast@mybalto.com. We'll see you next time.
Thanks, guys. See you soon.